Hi everyone, I'm Megan Darty, the Educational Content Specialist at Healthcare Source. Thank you for joining us today. It's my pleasure to welcome Jim Kinsey, Senior Consultation Services Specialist at Plaintree, and our usual host, Rebecca McNeil, Senior Education Manager at Healthcare Source. We'll actually be acting as a panelist today. As some of you may know, on April 1st, we launched our first annual Plaintree and Healthcare Source Influence Survey. The purpose of the survey is to learn what kind of role HR plays in healthcare organizations when it comes to improving the patient or resident experience. In today's podcast, we're going to share how HR can and should influence the patient and resident experience. So first, I will hand it over to, I'm going to ask Jim. Do you believe that most organizations consider HR to be a leading force in their efforts toward the patient and resident-centric environment?
Thank you. I think that most are beginning to warm up to the idea that HR does have an influence around the patient or resident experience. I think that not enough people are making that connection yet, however, between HR and the experience. Many organizations have in the past made the connection between human resources and quality human resources and employee satisfaction, but not necessarily have always made the leap over to the connection between HR influencing the outcomes of actual patient and resident satisfaction.
Okay, great. So Rebecca, what are some steps that healthcare organizations can take at the employee level to increase patient or resident satisfaction?
Thanks, Megan. That's a great question. So at the employee level, I think managers can implement tactical initiatives that will equal greater patient or resident satisfaction. Here's an example that I learned about actually from the Plaintree conference last year. Elmhurst Memorial Hospital started having housekeepers explain to patients what time they'd be in to clean the rooms. They closed the doors while they were cleaning to eliminate hallway noise, and they started actually using trash bins with quieter lids. And Elmhurst started to see that their quietness scores on the HCAHPS survey were going up as a result. So if you look at each measure in a patient or resident satisfaction survey and implement initiatives with your departmental frontline staff to address the measures that relate to them, I think you'll start to see those scores go up.
Great.
And Rebecca, I would just like to tag on to that, Rebecca, because Elmhurst is an excellent example of how they looked outside of the traditional scope of who is able to influence those satisfaction scores. So by engaging housekeeping within that process, they were actually using non-traditional staff to affect change in the HCAHPS score, which I think is a wonderful way that HR can influence the satisfaction scores for residents and patients.
Absolutely.
It's actually a great segue into my next question for you, Jim. Can you give us a few examples of how healthcare organizations can become a more patient or resident-centric facility?
Well, I think certainly looking at, like we were just discussing, the how to engage non-traditional individuals into that process, but becoming resident-centered or becoming patient-centered is really thinking about your organization going on a journey and really beginning to look at how do we capture not only the employee voice in this process, but how do we capture the patient and the resident voice in addition to their caregivers, family caregivers, in that process. And that is really truly one of the essential steps in becoming patient or resident-centered, is really having their voice involved in making the changes that need to be made. I think one of the other essential steps, certainly from an HR perspective, is not just finding the right person for the right job, which we're always hearing about and we always know is so vital to any kind of hiring process. But I think it's also important to realize that these individuals that are being hired into patient and resident-centered cultures need to be internally motivated with their purpose. They need to be connected to the reason why they come to the work so that they are able to then influence their work and their peers' work so that it can really change the satisfaction scores for an organization in an authentic way.
Great, thank you, Jim. So Rebecca, I have a question for you.
Okay.
What are the benefits to implementing talent and learning technology at healthcare organizations in order to improve the patient or resident experience?
Thanks, Megan. Well, there are many, many benefits to recruitment and performance management software that will help healthcare organizations harness their resources to improve customer satisfaction. But let's keep it short. Let's think about one instance of saving time and resource and use learning management technology as an example. So there are tremendous competitive gains for being compliant with the Joint Commission and getting that gold seal of approval. But if you don't have an efficient way to distribute and track employee accreditation requirements such as licensure updates and those annual compulsory education activities, you're less likely to be compliant. So a learning management system is a great way to ensure everything is easily accessible when it comes time to deal with the Joint Commission or any other accreditation body like the CMS and OSHA.
Okay, I have one final question for both Jim and Rebecca. So why should healthcare professionals participate in the HR Influence Survey?
Well, I guess I can answer that first and then turn it over to Jim. You know me, Megan, I love great content, and survey participants can attend the webinar following the survey on June 5th, where Jim and I are going to share some best practices for using talent management strategies to improve the patient and resident experience, and then there will be a follow-up report with the survey responses. And I can tell you that over 300 healthcare HR and hospital and long-term care executives have already responded to the survey, so we're going to get some great data from this. How about you, Jim?
I couldn't agree more, Rebecca. I think one of the opportunities of taking this survey with Plaintree and Healthcare Source is really to have the opportunity to have your voice heard. We talk about how capturing the patient and the resident voice in the process of creating resident and patient-centered care is essential. This is an important way of getting your voice heard as an HR professional within the content of what is happening in the profession and how we can begin to collaborate to advance the use of HR to increase satisfaction scores across the entire continuum of care.
All right, great. Thank you. Thanks, Jim. All right, that's all we have for today. Thank you for listening to our audio blog, and we hope you enjoy it.